Welcome back to Studio 5. If you find your libido lagging, it could be a hormone issue. Dr. Kirk with Genesys Medical Institute says about 70% of the women he sees experience low sex drive. That's a high percentage.
It is a high percentage.
One of the common things that you hear from patients.
Yes, one of the common things. And it's due to aging, menopause, you know, any number of factors. Medications, one of the main side effects a lot of times of medications, of common medications, is low libido.
So some of the causes natural, the menopause, the aging.
Sure.
Other things, like you mentioned, the medication can come into play as well.
Medication, stress, you know, those kinds of things can all affect it and affect your hormones. They affect all your hormones, but testosterone is one of the ones that...
So how does the natural loss of testosterone manifest itself in women? What symptoms do they experience?
Well, mainly low libido, low sex drive, loss of muscle, firmness. A lot of times kind of they get flabby arms, and so they'll come in complaining of that. Inability to, kind of, you know, irritability sometimes, and also kind of inability to kind of have any initiative. They just, you know, you just don't feel like you want to do anything. You don't feel like you want to, kind of, you don't have that drive that you used to kind of get things done, to do things, to kind of, you know, be excited about, you know, your day-to-day things.
So it can be an energy effector.
Absolutely, absolutely.
What are the options out there?
Well, the options are, you know, it's not your only hormone. So there are kinds of options, but testosterone replacement therapy is one of the options that very frequently is overlooked, and it can be given as a cream, just kind of a rub-on cream that you do once or twice a day, just depending on, you know, your dosing. It can be used as a sublingual absorbable tablet, you know, that you just put under your tongue and it absorbs. It can be done as a pellet, or it can be done as a shot.
And why not a pill? People, I think, sometimes wonder.
Well, the easiest, you're right. I mean, the easiest thing is just to take a pill, and but actually your GI system, your enzymes and your stomach acid and everything will break things down so that that makes it less absorbable. And also it's affected by what's called first pass through the liver, where the liver will actually break it down and then not make it usable to your system.
So how soon is the cream, for example, absorbed into the bloodstream?
Within minutes. You know, minutes. You put it on and within minutes absorb. Now, how quickly do you see the effects of it? It can be days, a couple of days. It can be a couple of weeks, and everybody's a little bit different. You know, you're different than I am. You're different than, you know, than your sisters, than your mom, than your friends. And so your absorption and the effects that it has on you will be different than the effects that it has on other people. And that's important because it's not a one-person dose. It's a, you know, it's something that we work with everybody to try to figure out what your dose is going to be as my dose or somebody else's dose. Very
individualized approach. If someone were considering testosterone therapy, what are some other factors to weigh into consideration or to keep in mind?
Well, I think the biggest thing is just to evaluate, you know, what your other hormones or levels are doing. You know, a lot of, one of the biggest manifestations that I see is a lot of people are concerned about, you know, men and women, concerned about their cholesterol levels. And low testosterone can manifest itself in high cholesterol levels because you lose your metabolism, you lose that muscle mass, and your muscle mass is what kind of gets things going. And so if you don't have that metabolism, then a lot of times you won't metabolize your cholesterol. All of your hormones come from cholesterol. And so if you're not metabolizing things and you're not making hormones, then that precursor to all of those hormones gets left behind and will accumulate.
Well, it's a big topic, one that affects a lot of women out there. If people have more questions, how can they get a hold of you?
Well, they can get a hold of us through going to our website, genesysinstitute.com, or calling us at 685-2730.
Okay, sounds great. Doctor, thank you so much for stopping in. Of course, we'll post the information on the Studio 5 website. You can check it out after the show.